All right. So today we're going to talk about the behavioral theories, behavioral approaches. There's only one behavioral theory. And this will focus on the behavioral theorists, therapy. We'll talk about the conditioning and operant conditioning, or the classical and operant conditioning. We will discuss the key tenets of the behavioral approaches, the source of dysfunction, goals for therapy, the interventions. And those interventions specifically would be the ABA, CBT, DBT, ACT. And then we'll look at limitations and multicultural considerations. So I want you, before you even look at this PowerPoint, I want you to go back onto the Moodle page and look at that video that I've put up there. It's a YouTube video. It kind of is just a simplified version of behavioral theory, just summed up into like 7 or 8 minutes. So look at that and then come back to this PowerPoint if you haven't already. So behavioralism basically gives little attention to cognition and emotion and only focuses on the behavior and conditioning within an environment. Just like that video talked about, people do things to avoid punishment or gain reward. And the entire goal of this is to change any sort of maladaptive patterns in the patient and the client. So over time, the patient learns how to maintain acceptable change behaviors. And now some of the words used throughout this chapter may be very vague, I noticed, and I know the book is a bit complicated. So I tried to only pull out certain things from the text to really simplify this whole theory. And many of the words used to describe behavior therapy and approaches can be vague because you're asking yourself the question of like what would be considered acceptable, because that word acceptable is used throughout this describing this theory anyway. And then you really want to focus on acceptable based on the client's needs and also their environment. So that definition of acceptable seemed to change based on the patient, okay, and the desired outcome and their environment. Right. Just like the video you watched, the speaker pointed out that different instances like traumatic life events, parenting, shaping, child rearing, media influences can affect a person's behavioral perspective. Okay. So with the operant conditioning, that one, not operant conditioning, classical conditioning, that one was established with Pavlov and Watson. And the classical conditioning states that our responses occurs when it is paired with an environmental condition. So various behaviors throughout life can either be increased or decreased depending on the stimuli that's present in your environment. So just like with the dogs, right? Now, stimuli can either be conditioned or unconditioned, and the response can either be conditioned or unconditioned, and each are adaptive. So the unconditioned stimuli leads to an unconditioned or an automatic response. Right? And then the unconditioned response, you do things involuntarily, without thinking. Just that automatic response. That's why it's either called automatic or unconditioned response. And then the conditioned response is a response that's learned through a neutral stimuli. So neutral as in nothing is too crazy about it. And then the conditioned stimuli can trigger a conditioned response, like dinging a bell to get service. The association with seeing a customer is the conditioned response from the conditioned stimuli, which is that bell. So if you touch something that you didn't know was hot and you pull away from that thing, that you didn't know was hot, it's an unconditioned stimuli being that hot thing, and you pulling away is an unconditioned response that is adaptive. So from now on, you won't even touch that thing. Okay. And then the text gives a a good example of a kid and their sibling, with the sibling being bitten by a dog. And the barking of that dog is a neutral stimuli, but now is being paired with the fear of being bitten by a dog, which is that unconditioned or unconditioned response. Now, but since there is a fear tacked onto it, it's a conditioned response. So when they hear a dog, they now experience fear. Now, adaptive conditioning can be a way of protecting, right? If you associate that barking with fear, you're going to try and protect yourself. So you either not go around dogs at all, you go around the block to avoid the dog. But then a therapist might say things like, well, you can't be afraid of dogs for the rest of your life, right? But that's that automatic response now. And in classical conditioning, the role of the client is to identify the behaviors that they want to change or completely eliminate, and the counselor aids that person in the exploration. So the counselor also provides insight into those behaviors, right? So we don't only just say in a rigid way or in a sarcastic way, you can't be afraid of dogs for the rest of your life, but we help people explore those behaviors that they form because of the stimuli and things like that. Um, and when we do that, it helps increases a client's self-awareness, which ultimately, with what I consider, the goal of therapy is to increase that self-awareness, right? So the counselor may also make the client aware of the different behaviors that they are using that might not be in alignment with their goals, that incongruence, right? The counselor teaches those skills both the counselor and client are responsible for developing a plan. So that collaboration piece. And the client is responsible for actually engaging in those skills outside of the therapy setting. Accountability is really big here with this piece, with the classical conditioning. And with careful confrontation, helping to hold clients accountable. And you can say things like, I am noticing this, or I am noticing that, and the incongruence within those two. And then B.F. Skinner with operant conditioning. Now he focused on operant conditioning, which said that behaviors can be learned or changed through reward or punishment. And operant conditioning says that if you continue to repeat maladaptive behaviors, it could be a detriment to your mental health. Now, if individuals are rewarded for those maladaptive behaviors, you just keep doing it because that's what it brings you pleasure. So if it brings me pleasure, why would I stop? It also has the opposite effect that if an individual is not rewarded for any sort of positive behavior, it can lead to them decreasing or completely removing that positive behavior. Someone does not get enough attention at home, and then when they go to school, they get attention from peers when they pick on a certain kid. So them getting that attention that they crave is that reward, and that reward reinforces that maladaptive behavior, which is the bullying. Now, another example can be if someone who exhibits positive behavior is not reinforced or shown any sort of love for that good behavior, that can affect their mental health as well, leading to any sort of like depression or feelings of inadequacy, things like that. And since this one relies so heavily on reinforcement and punishment to change behaviors, um, and that modeling intervention comes in. So both counselor and client rely on each other. So there is that collaboration piece on what negative or positive reinforcements to add in place to help change that behavior, right, in order to have that desirable outcome. And again, the counselor is the person holding the client responsible, but that accountability piece is there too. But then with this one as well, there's continued review of what is working and what is not. So again, careful confrontation. Positive reinforcement means, now I had to read this section, I don't know how many times because I confused myself. But positive reinforcement is a reward given to positive behavior so that the person can continuously do that behavior. And that the negative reinforcement strengthens the behavior by removing undesirable outcomes. So if your child pouts when they have vegetables, so you take the vegetables away. The negative reinforcement is taking the vegetables away since kids need vegetables, apparently. And they're going to pout every time because they know you'll take it away and you just got played. And then there is also positive and negative punishment. It appears as though positive and negative punishment results in getting something done. So positive punishment gives something to decrease negative behavior, and negative punishment takes away something to decrease negative behavior. Now, I will say the video says violence to animals. Something about hitting a dog. I do remember that. So I will say that we do not condone violence to animals, and that is not the greatest example to use. So let's just, let's pretend like we didn't hear that. So smacking a dog is probably not any sort of thing that we want to do related to this, what we're teaching you. So let's just not even use that example. You can Google 1,000 examples if you want to that are way better than that one. So it seems as though many of the examples in the text also focused on child and adolescents. And it makes you think that these examples used will say something like this theory might only be can only be applied to kids or more successful in kids because kids can be easily changed or influenced. And you don't want their behaviors to turn into issues when they get older, stuff like that. Yes, that is legit, right? This can be used with children, but then also a bunch of other things can pop up in your head when you think about where to use this approach. Now, behavior therapy can be used within the criminal justice system as well, especially in the world of like AODA, alcohol and other drugs. The negative reinforcement is very prominent in that setting, and people often have their sentences reduced all the time, really, if they engage in some sort of alternate treatment, some sort of diversion. Now, I know that I said that you were played previously when your kid made you take away the vegetables as a negative reinforcement, but then also too, negative reinforcement can help strengthen a positive behavior as people grow and develop in new skills to reinforce healthy behaviors. So the negative reinforcement of not putting someone in jail can strengthen their healthy boundaries if they engage in treatment in an honest and genuine way. So the key components of behavioral approach. A couple of the components that I wanted to point out, um, again, is that behavior is learned and it has a purpose based on environmental factors. New behaviors can be acquired. Maladaptive behaviors can be changed through learning. And then behaviorism focus on the present when looking back at the client's past. It's just to understand how they were conditioned. So an emphasis is placed on observing the client's behavior patterns. So assessment is ongoing in this theory, and a therapist continuously aids in the reversal or modification of behaviors and implementation of new skills for them to utilize throughout treatment inside and outside of the session. So if you look back at your case conceptualization or the conceptualization sheet that Dr. Massengale created so lovely at the beginning, the second week, and we've been using that throughout the first half of the class. If we look at the source of dysfunction, the goal of therapy, like the therapeutic process, and then we go into the interventions that came from behavioral therapy. Remember that the source of dysfunction is interactions with your environment to shape behavior. And the primary goal is to change maladaptive behaviors or reactions to certain stimuli. Learn new behaviors that are healthy and effective when it comes to interacting with your environment. And remember to keep in mind that behaviorists believe that all behaviors are acquired through conditioning. And we've already talked about that earlier. And the interventions. ABA, CBT, DBT, ACT. Now, anyone who's been in the world of mental health, some of these look familiar to you. And again, a lot of these techniques are like interchangeable. You could be a humanistic therapist again and use CBT. Like literally everybody uses CBT because it's effective. It's empirically studied, evidence-based. It works. Now, maybe it can't be used for everything, but it's used for a lot. So the therapeutic process can depend on the approach you use. This also goes into the interventions. And the techniques we talked about before with the positive and negative reinforcement, so on and so on. We also can get into things like modeling and shaping, which are behavioral approaches. Shaping is demonstrating desired behavior, or not shaping. Modeling is demonstrating desired behavior. So with modeling, is actually based on a theory called social learning theory, which states that social behaviors are learned through imitating and watching the behaviors of others. And shaping is where behavior modifications can slowly happen over time. So it doesn't require the behavior to be displayed right up front, but growth and learning to continuously occur over time in order for that target behavior to be changed. And small rewards are, given throughout over the period of time. So it's a little bit more of a slower process than that modeling piece, that mimicking or shaping. It kind of is self-explanatory if you look at both of the words, and that's how you can remember it. So the text explained that many of the behavioral approaches used now is a mix of cognitive and behavioral approaches. Um, and it talked about how usually behavioralists, um, some of them solely focused on behaviors alone. And then as time, went on and we progressed as humans and all that good stuff, they added components of cognition, thoughts, emotions, affecting behaviors as well. So it's not just behavioral. A lot of the behavioral approaches have that cognitive piece in it, which we'll talk about next time. So just a touch on the different interventions. ABA, I don't know too much about ABA, and I know you can be licensed or have certifications in ABA. So applied behavioral analysis aims to increase behaviors that are helpful and decrease behaviors that are harmful, and the behaviors that can affect learning. So this is commonly used in individuals with autism spectrum disorder. CBT is cognitive behavioral therapy, and it basically says that change the way you think in order to change your behavior. Super easy, like one sentence explanation. Change the way you think, change behavior, bam. Sounds easy, definitely not. So your emotions and your cognition, they play a role in your behavioral development. That's what CBT says. And individuals use the word cognitive distortions. And I hate to use the word distortions because it makes it seem like it's so bad. But cognitive distortions can be things like black and white thinking, or the shoulds come up, catastrophizing. All of those things lead to maladaptive behaviors. So CBT, like I said, is very evidence-based. And the goal, like I said, is to identify those unhealthy thoughts in order to change those behaviors that influence, right? The thoughts that influence those behaviors. Those behaviors are usually not the greatest, so keep that in mind. And then with DBT, dialectical behavioral therapy, it's also very empirically supported, evidence-based. DBT is done in an individual setting or a group setting, and you usually have to be trained in DBT. But DBT is meant to help individuals tolerate stress, like regulate emotions, negotiate like stable relationships, social relationships. DBT is used commonly with people who have like suicidal ideation, those personality disorders. And there is an emphasis on decreasing any sort of self-destructive, impulsive type behaviors. So individuals who are not professionally trained in DBT, but know DBT techniques, can use those techniques within therapy, like distress tolerance skills. There's a heavy emphasis on mindfulness, emotion regulation. Those can be taught anywhere. You can even use them for yourself, to be honest. And DBT, they also have stages. And I won't go into that, but if ever you're interested in, you have a little extra money lying around, you can get certified in DBT and look a little bit more into the stages there. And then ACT, acceptance and commitment therapy, is that humanistic component for all of my humanists out there, or Dr. Massengate. This focuses on accepting those emotions or thoughts that might not have been the greatest, those unwanted, right, are harmful behaviors, and having the commitment to changing those things. So acceptance, commitment. This also goes into looking at your values and morals and focusing on having your thoughts and your behaviors align with the values and the morals instead of the maladaptive thoughts and behaviors from before. And again, that's where that mindfulness piece come in. So you can use different components of ACT within therapy to help individuals understand how to gain congruence with morals and values, and how they wanted to align with their new behaviors that they want to develop. Limitations and multicultural considerations. I want us to talk a little bit more about this piece in class, but I did point out just a couple. One limitation that really stands out to me with this theory is the fact that with only exploring observable behaviors, you fail to explore all those underlying factors that can contribute to someone's behavior. So if you don't broach another piece with the multicultural element is that if you don't broach uncomfortable topics in class and in supervision, as a way to receive guidance on how to talk about cultural norms and cultural normative behavior with your client, that could be an issue, because you might misinterpret their behaviors or their cultural norms as maladaptive, if you are unfamiliar with what's going on within that culture. Okay. Another issue is that the majority of the work is done outside of the session. So the counselor relies heavily on the client to do the work outside of, in the community. And when it comes to actually reinforcing behavior and changes, that can be hard because someone sees you 1 hour a week, 1 hour every couple of weeks. Sometimes people check in once a month with their therapist. And the majority of the triggers that they experience, it's outside of that office. So you got 1 hour with me, the rest of the hour is out there by yourself. So it's usually very hard to try and get people to engage in the therapeutic process if you're only reinforcing them that one time. So collaboration is really important when it comes to behavioral things. But also keyword is collaboration. We don't want to develop a codependent relationship because behavioral therapists, counselors can be, not counselors, clients can be very dependent on their behavioral therapists. So homework is very important. So all in all, behavioral approaches attempt to change behaviors by altering environmental conditions that maintain them, and those behaviors are learned and has a purpose based on the environmental factors. But maladaptive behaviors can be changed and new behaviors can be learned. Thank goodness.